At the onset of the COVID-19 pandemic, analysts feared it will mark a disaster for women. The strain of coronavirus lockdowns will exact a disproportionate toll on genders, forcing more women out of the workforce, deepening their load of uncompensated labor, and leaving them more vulnerable to domestic violence. This webinar series is organized by Owando plc, Nigeria's leading energy solutions provider, in partnership with the Nigerian Economic Summit Group, NESG, Africa Business Radio, and Ventures Africa, with this quarter themed COVID-19, Vaccinating the Shadow Pandemic. Speaking on gender violence, Ms. Tosin Akibu said 24 states recorded 390 cases of gender violence.
Last year, February of 2020, just before the declaration of the lockdown in March, in some of the total of 24 states, as at February of 2020, had reported roughly 390 cases or incidences of gender-based violence. But by the middle of April, just 2 weeks after lockdown, gender-based violence incidences had spiked to 794 from less of the total number that I had reported earlier, that had reported in February. In some instances, some of our centers that had interacted with about 5 at the beginning of 2020. By the middle of April, we're seeing 100 either reported cases or persons that had to just leave the house and find a way to get to the centers.
Highlighting the structure of shadow pandemic, Ms. Tosin Akibu touched on processes and more.
So several things were kick-started at the same time during the 2020 COVID-19 incident, ranging from engaging with critical stakeholders like government, like the private sector, like institutions, setting up one-stop centers, engaging directly through women's movement with the presidential task force. Because at the beginning of that lockdown, there wasn't any concrete plan in place to attend to incidences of gender-based violence because there was complete lockdown. People were shut in, seemingly with the enemy. You know, the perpetrator and the victim would go out in the morning. Usually you come back at night, but suddenly you're home 24 hours and you're seeing each other. And so violence prevailed. And so because people couldn't access services, they would get to the road, the police would turn them back. The women's movement came together and under the joint EU-UN Spotlight Initiative, came up with a joint statement that had almost 300 signatures across Nigeria to the presidential task force saying, we need gender-based violence to be recognized as gender-based violence response to be recognized as an essential service.
With the demand for bodies to oversee and manage affairs bordering around gender-based violence, Women at Risk founder Dr. Kemi Da Silva Ibru touched based on factors that bettered the organization.
As you rightly said, I established the non-profit WARIF, the Women at Risk International Foundation, in 2016. But I've been working with women as my target audience for 20 years, being a practicing consultant gynecologist. And working in the public space in Nigeria, the very first thing you recognize are the disenfranchised girls and women being seen many a time in public sector hospitals. Only very recently have we started to establish specialized sexual assault referral centers, and I would say we still only have 17. But having said that, I started out being a practicing gynecologist, witnessing firsthand the cases that Tosin rightly alluded to. I have taken that 2-year-old into the operating room that was violated by her father. I've taken that 60-year-old woman that was raped in her home. And I've seen many women between those two ages. So recognizing that you have a prevalent problem and appreciating that in spite of the fact that we do have infrastructure we needed more. And this is why I decided that I would throw my hat in. I would establish a foundation that would clearly have established guidelines and deliberate mandates in addressing a problem that had such a huge.
With organizations erupting, there is still the presence of culture and cases of victims not speaking up. Dr. Tomiwa Erinosho is of the opinion that these can change.
Last year, we partnered with the Social Science Academy of Nigeria, who have a track record of addressing gender issues. But also, we could now essentially, Town Talk as a technology company could use technology to operationalize support provision in gender-based violence cases. What does that mean in particular? That means that we have essentially adopted a technical framework that can help us operationalize and provide or address a lot of the issues that you have raised. And what's this technical framework? For the academics, we call it the Psychosocial Support for Emergency Situations Framework. But what that means is there are 4 layers of support that you can provide to survivors, and these are the 4 layers. The first layer, which is the base layer, is your ability to advocate for right-protecting, dignity-protecting spaces. What does that mean? That means being able to ensure that the survivor can access support conveniently, in a right-protected way, in a dignity-protecting way, removing some of the stigma. So, for example, you go to the police station and they say, you say you were harassed, and the policeman says, or the police officer says, why were you wearing what you were wearing? And so we want to cut out some of those stigmas and comments that are associated. And how we are doing this by essentially deploying a range of technologies. So a mobile application for reporting incidents of gender-based violence, as well as other security incidents, because again, security is a totality. We built a USSD application, *347*0# that helps you, brings you into this ecosystem of support, and of course is able to reach people in remote communities. And we are essentially setting up, we have a toll-free line, and we are setting up a small call center, which is constantly scaling, but because we have enough technology, we can limit how fast it scales. And so those are some of the basic advocates, basic tools that we use to eliminate this or address these issues of stigma.
No doubt, solutions are in the works to control gender violence, but it is said that to tackle a problem, the base must be unraveled. Oliver Stubb shares answers to questions as what prompts gender violence.
But I think there's one important thing that I've not heard yet coming out as clearly as I would wish to, which is really the issue of impunity. Essentially, we need to be very clear. Tosin said it very well. Obviously, the problem is the perpetrator. But everybody talked about the victim so far, essentially. We need to also start focus on the perpetrator and those resources that the state needs to be putting in place in order to actually address the situation of the perpetrator in terms of their criminal justice accountability. I'm not calling for the death penalty or any of that kind of extremism that sometimes comes into this discussion, and I think that is just as unhelpful as basically the wish, so to speak, to only address the needs of the victim. We need a criminal justice system that is basically equipped, first and foremost, with well-trained individuals, professionals, whether we're talking about the frontline officers, very often the beat policeman that essentially is the first one on the scene. How do they react to a situation of domestic, of gender, or of sexual-based violence, alleged or actually in process? Then we have the issue of The people in the police station, most notably the investigators, are they trained actually in doing the right thing, collecting the evidence, and very importantly, not re-victimizing the victim in the process? Of course, prosecutors and judges, very importantly, do they have the necessary laws to actually establish the protection, for example, of the victims? I think we have at the moment a situation where essentially gender-based violence offenses are generally bailable. That means even in the case that everything goes well up to that stage, that alleged perpetrator of the gender-based violence will, after a short while in cell, pay their bail or have a shorty standing in for them. And the judges do not have necessarily neither the training nor necessarily the laws in order to prevent actually the perpetrator from going back to exactly the same place where the offense was committed, his home. So there's all these kind of layers that I think are contributing to quite some weak response as a society. And let's not forget that the criminal justice, the victim support is one part of the response of us as a society. The other one is basically holding the perpetrators to account. And we are doing actually a poor job on both ends. And therefore, we should not be so surprised that we are actually seeing across all societies.
He spoke further on the persistent trait of gender violence across continents.
But the truth is, the general trend of gender-based violence persists. Actually, it was France, I think, that was the very first country that raised the alarm about the raising the cases of gender-based violence, the call into the hotlines, and of course, the victimized women, mostly women and girls, essentially coming forward to the centers, the shelters, and so on. So we see this across basically the globe, and we have been not very good at responding at that part, and that is, I think, also something that in the context of Nigeria is very important. And that comes, of course, at a moment when we see actually a sort of like competition for priorities. On the one hand, the police is being asked to, as a result of the pandemic, to tackle a whole range of additional challenges. We have a general raise of insecurity that, of course, keeps the police busy. At the same time, we will actually see government, because of the general economic downturn, having less money to invest into the criminal justice system in order to perform its functions.
Having said all that, what role can government and private individuals play in controlling this gender violence as a pandemic?
So what I'm asking, we need to have coordination of all our public services across all our states, our health, our justice, law enforcement, and social welfare services, because that's the only way that we can actually see a shift in the needle. We have laws, and I'm sure probably Oliver or even Tosi may speak of the VAP Act. This is an act that we've spoken of day in, day out. We've established it. It's an amended law. It works. It covers the bases. It talks about rape. It talks about all the other aspects of gender-based violence. But unfortunately, as we speak, only 23 states out of 36 have domesticated it. We talk about child abuse, and we say we need to protect the child. We know this. I've mentioned personally having to treat children. Tosin has mentioned in her other center, a 2-year-old. But then we have a Child's Right Act that only 25 states have domesticated across the country, and this is from 2003. We have a National Offenders Registry. I'm not sure if you're aware of this, Demola, from last year. It's documented 602 cases. 38 have been convicted. In Lagos State, one of the more progressive states, we have a special sexual offense court. But how about the other 35 states? And I mentioned sexual assault referral centers. We have 30 of them across 17 states. But in Lagos alone, we have 4. and we've had 8 new ones since 2020. There has to be a cohesion with all the actors in play. It's not just one governmental problem or one civil society addressing this. And as you said, it starts with the individual, taking ownership of the problem in the community, allowing that survivor to speak out, giving her that platform from her home. People speak of even the way we bring up our children, the fact that we allow our boys to be brought up entitled, and we encourage our girls to be subservient in the house and to be silent. How about we start there, appreciating the equality as the child is born, and giving those children, whether it's a boy or a girl, equal opportunities. We talk about policy. How about recognizing that beyond having that lovely roadmap, we need to implement the policy? At the organization, Oliver mentioned police officers. Lagos, for instance, we have family support units that are specially trained to address gender cases, but there are only 12. And we're 21 million people in Lagos alone. This is one of the reasons why we actually established a gender sensitization program for police officers. I believe we've trained up to about 900 of them and counting, because that's an aspect that is critical in addressing the issue. Tosin mentioned that yes, perpetrators are the underlying cause because rape occurs because of rapists. And you're right, it does occur, and they will continue with impunity, except we all make deliberate efforts to ensure that they don't. And it starts in the community and then works its way out, ensuring that all the different aspects of public services are tackling the problem cohesively and in a deliberate fashion.
But with the invention of social media and other communication platforms, issues as rape have been taken as comical issues by notable persons and otherwise. Speaking on how to counter this narrative, Dr. Tosin Akibo spoke about collaboration with the movie industry.
We have plans, very solid plans, to work with the Actors Guild of Nigeria to support the process of reviewing the content. What is it that we put out there to Nigerians? People watch TV a lot. People watch African Magic a lot. And so that is one viable way of getting the attention of the community. Another thing is that the public and private sector should expand their collaborative efforts. At the beginning, I was going to ask you that, do you know the cost of violence against women in Nigeria? If we sit down and calculate it, there was a study recently that showed the average cost for a victim of gender-based violence is about 17,000 naira. This includes hospital minus legal costs. Dr. Kemi mentioned that we have a lot of legislation, we have the VAP, we have the Child Rights Act, but do we have monitoring tools in place to ensure that they are not only implemented, they are enforced, and that they're used in the right way? Social media is there. It is a strong, viable weapon. It is a medium that cannot go away in a hurry. You see hashtags. You saw the recent one about the lady who unfortunately passed on in the hands of someone who tricked her to say she should come for a job. And within an hour of her friend putting up an SOS, people had tracked this suspect to where he was. And before you knew it, there was an uproar. How can we harness this new media to be able to direct our narrative, to be able to support society to shift harmful stereotypes? I like what Tomiwa said. We're moving away from, hello, my husband just beat me now, to being able to just tap a button on your phone. Whether you're a woman with one disability or the other, you can seek for help. But we cannot get there if that collaborative effort does not take place. There has to be that time when private sector and government comes together beyond collaborative efforts on joint initiatives? Can we set up a GBV fund that covers laws and policies, strengthening institutions, prevention, which is at the community level, social media engagement, service provision, data collation for funding purposes, for information purposes, and strengthening women's movement, strengthening the coalition within the country. So it is very possible to use social media. It is currently being used, but we're not doing it enough. And until critical stakeholders come together to make it intentional. On the joint EU-UN Spotlight Initiative, for example, we will be engaging with the Federation of Women's Female Footballers of Nigeria to see their football matches going on, their adverts that run through the field. What do we want to say using that opportunity? I know some people would not sleep until they watch football. And if their team loses, they're sick for 1 month. And so they get information from that engagement. But as my colleagues, my co-panelists have said, the problem of gender-based violence is multi-sectoral, is multifaceted, and so must be the solution for it. Yes, we must look at laws and policies. We must look at institutions, prevention, service provision, data collection, garnering coalitions to make sure that we prevent and respond to this.
As a resolution plan, Oliver Stope is of the opinion that collaboration is an important tool at managing gender violence awareness.
The collaboration bit is very important. It is hugely difficult to achieve. You rightly pointed out, I've been working in Nigeria and with Nigerian institutions for an extended period of time, 20 years almost. And I've always been, both fascinated and challenged by the difficulties to achieve domestic coordination and cooperation. And then, of course, it sort of like translates even to the international environment. Though I have to say that sometimes it's almost easier to achieve international cooperation. Now that is maybe less relevant in cases of gender-based violence, but for example, for human trafficking, hugely important. And there I see often institutions working more seamlessly across borders than, for example, to achieve cooperation at domestic level, when various agencies, for example, need to come together to work together, to share information, to divide labor in a logical way, to not compete with each other, and so on and so forth. And that is something that I think collectively we need to learn. We as development partners need to learn of how to help actually with overcoming this kind of challenges to domestic coordination. And of course, institutions themselves need to overcome it and see somehow the collective value of achievement more important than the individual agency's achievement. And I think there we have quite some road still to cover. And then there's, of course, many other elements that you touched about now on drugs and corruption and so on. But honestly, don't challenge me to throw those into the mix. I think we have enough to chew on the challenge of gender-based violence. And I think it is very good that we've been focusing our attention really on this specific topic and remain specific, and hopefully that will actually bring upon some good ideas that will eventually induce change.
This has been Owando Webinar Series, a platform for engaging discourse among thought leaders, including public sector officials, senior decision makers, business leaders, research analysts, as well as subject matter experts from across the world.